The first angioplasty, which is using a balloon to open up the blockage, was done in September 1977 by a physician called Andreas Gritzik. And from then on, there's been no looking back. The field of interventional cardiology has progressed, and nowadays there's usually a non-invasive method to intervene compared to just bypass. Hello, hi, my name's Dr Pinakin V Parekh. I'm a general and interventional cardiologist based here in Singapore. So I treat all aspects of the heart, and my subspecialty focus is on interventional cardiology, using minimally invasive methods to solve problems in the heart. Interventional cardiology is a special branch where minimally invasive methods are used to gain access to the heart and treat physical problems which arise from disease processes. For example, one of the ways we intervene is blockages in the heart. Opening up blockages using balloons and stents is a form of interventional cardiology. The other aspect is some people have problems in the valves of the heart. Now we have minimally invasive methods to deal with that also. So medications are state of the art. There are benefits of medications, but interventional cardiology goes one step further, where medicines can do the full satisfactory job. So interventional cardiology is reserved mainly for patients who have symptoms that require more than just medications. Example, these are patients with chest pains, blockages, valve disorders that need some form of intervention to help improve the symptoms even further, and intervention to even try to increase and maintain their lifespan. I mainly do blockages and trying to open up and re-establish the blood supply to the heart. So it typically has a few parts to it. Part number one is gaining access to the heart. And this is not open heart surgery. Remember, the key word is minimally invasive procedure. So what it generally involves is getting access through an artery. Mainly it's through the artery of the wrist. In more complicated procedures, we go through the groin. And it involves the passage of tubes and wires and balloons and stents through the access point here under X-ray guidance in an operating theatre. There are some additional tools that we use these days. We even have special cameras that can go inside the heart's blood vessel, to look at the structure of the blockage and determine the sizing of the stents that are required. So very technical, keeping it very simple, get access to the heart, use some devices to deal with the blockage, and use X-ray guidance to help us. So the recovery is very fast. So most of my patients, first of all, just to take a few steps back, patients are generally awake during these procedures. This is not open heart surgery, so they're awake. Sometimes we do give them medication injections. It's called light sedation, so that they are less anxious. And after the procedure is done, all we do is we take out the access point, the tube, put a compression bandage, and they go to the high dependency for monitoring purposes. Typically, if they're well, they go home the next day and they're active and walking about. So it's not like months or weeks of bed rest. They're up and about almost immediately, a few hours after, and home the next day. So, this is one of the procedures that we are doing something on the beating heart. So as I'm doing my procedure, the heart is still beating as per normal. The blood vessel is a structure which has walls. So some of the risks involved include a heart attack, stroke, cardiac arrest, bleeding from the artery. But then again, all this, the typical percentage that we quote patients is about 1 to 2%, low risk. So usually they do see me in the clinic. We do some basic blood tests to look at the blood counts, to look at the kidney function, because some of the medications that we use can affect and drop blood counts even more. The dye that we use during the procedure, the X-ray guidance, the dye that we use to highlight the arteries can affect the kidney. So we want to make sure that the kidney is okay before going to the procedure. And even if it's not okay, there are some methods we can use to mitigate the risk. This includes hydration. We put a drip, run fluids to help wash out the effects of the dye. Some of them require, actually most of them do require blood thinning medications before planning for a stenting procedure, because the stent that we put in is a foreign object. You need to prevent blood clots from happening when we put in a foreign object before it gets internalized in the body. So during the first few months of the procedure, you'll be on blood thinners to help reduce those chances of an acute blood clot inside the stent. As much as I am an interventional cardiologist with a skill set to help with the problems that people have in terms of blockages, when people see me, I always tell them that prevention is better than cure. And there's certain things that you can do to prevent yourself from coming on to one of these procedures. And that's usually looking into a few cardiovascular risk factors. Most of these cardiovascular risk factors are silent. Blood pressure, high sugar diabetes, high cholesterol. In your early years, these things are silent, and the only way for you to know that you have that is to go for regular screenings. The word screening means you have no symptoms, you go and screen and look for it. So if you have them, you can intervene earlier. Number 2 would be smoking. If you smoke, I've never seen or heard any doctor say smoking is good for the body. And it's not only for cardiovascular disease, it's for other aspects also, lung, cancers, and a wide variety. Smoking is a big problem, definitely a no-no in my mind. Cardiovascular risk factor screening and physical activity. Easier said than done. All of us are so busy in life. Physical activity, if you can find time for that, it's very important. It helps with your cardiovascular health. Sounds very simple, but very hard to do. And I see so many patients neglect this. Another important point I'd like to emphasize to the audience is whenever you have any symptoms, some vague symptoms in the chest or in the tummy, try not to diagnose it yourself and belittle the symptoms. There are a lot of people who will have some symptoms and will say, it's gastric, let me try some medications. But it can turn out to be a cardiovascular problem. So you find your symptoms are not going away, they are coming back very frequent, always seek medical attention. I see quite a number of patients with epigastric stomach discomforts, chest discomfort, and it turns out to be a blockage and not just a simple reflux acid problem. So always see a primary care practitioner. If you want to see a specialist, that is also fine to try to divide between the two. That'd be very useful.